everyone, welcome back. I'm Mabel Jong, and you're watching the World Healthcare Congress coverage here in Washington, D.C. And right now, here in the studio, we have Igor Kozunov, who is CEO and managing partner of a firm called Wellness for Life Medical, really responsible for helping employers come up with innovative ways to increase health and wellness in the workplace. Igor, thank you so much for your time today.
Thank you for having me.
Well, in terms of innovation, which we were just speaking about, what are some of the innovative methods you're approaching wellness in workplaces?
Great question. What we do is primary care, direct primary care. So wellness, we believe, is truly just a subcomponent of primary care. It's prevention, it's keeping people healthy, and even when they're not healthy, right? You still want to manage a disease and illness in a way where it's optimal, right? If you're already sick, you don't want to be going through the nightmare of figuring out where to go, who's going to take care of you best. And that's really the role of primary care, or at least the role that primary care should have, is to be an advocate and a manager for the patient, regardless of your health situation. Unfortunately, the way most modern primary care currently operates, and in the way it evolved, is that it no longer focuses on this care management component. Basically, if you're healthy, you don't really have a doctor, right? Nobody's really looking out for you how to keep you healthy. And then the flip side, when you do get sick, a primary care office is just there to give you a referral to a specialist who's going to take care of a single problem at a time. Unfortunately, when people do get sick, usually oftentimes they're very, very sick. It's not just one issue, right? A lot of specialties get involved, and oftentimes this crucial component of care management is missing. So that's what we're bringing back.
Okay, and how are you bringing it back?
Well, so what we do is called direct primary care. And direct primary care essentially removes itself from the traditional fee-for-service model, meaning that we don't bill per visit. When you bill someone for every time they come in to be seen, it creates an incentive to focus on sick people, right? Healthy people essentially don't pay your bills. And that's what fee-for-service model does. It focuses really a sick care system rather than a health care system. So under direct primary care model, we take care of the entire population, essentially in a capitated format, membership model, right? So once you belong to our practice, usually it will be an employer or even sometimes individuals who will join our practice. And as part of access to the practice, they have unlimited primary care, unlimited preventative care, unlimited access to maintenance medications, laboratory diagnostics, all of that is included. And when you look at the outcomes and the actual cost of that, the cost really ends up being a fraction of what you would typically end up such a service to cost.
Okay, how does it compare with more traditional models like ACOs and also traditional HMOs then?
Sure. Let's start with the HMO. In the traditional HMO, obviously there wasn't the intent of an HMO, but what it evolved into is it began to focus on primary care doctors more as gatekeepers, right, rather than care managers. And that drove to a lot of patient resentment. Because patients felt that primary care really at that point stood in the way of their care rather than really truly helping them. Direct primary care, again, it functions as patient advocacy, right? We're not gatekeepers. We don't work at the behest of the insurance company. We don't get any reimbursement from the insurance company, right? So what we are able to do is when working with health insurances and health plans, we can replicate the better pieces of the HMO model, by operating direct primary care on the outside of that plan, we're now able to connect patient advocacy with the financial goals of the HMO and arrive to a better outcome.
Okay. How has the reception been to what you're proposing?
It has been, there's definitely a learning curve. So the reception has been great once you get on the other side of that learning curve. People, it's hard to change patterns. When people think of healthcare in very simple terms, right? You have your insurance and you have your doctor. One pays the other takes care of you. There's a lot of complexity in the middle, a whole lot of gray areas. And oftentimes the incentives that people on both sides may have are not that easy to figure out.
Okay.
And so, again, the learning curve. Once we're able to explain to our prospective clients or even patients how these incentives and the relationships work in the healthcare system, it starts to make sense for them why they truly need to have their own advocate who's removed from the system. Because, again, the key piece to what we do is we are not part of an insurance plan, right? We operate on the outside of it. We are the advocate.
Okay.
Working for our client, for our patient.
So who ideally are your clients?
At this point, really everyone. When this model first started out, it initially focused on large employers, on Fortune 500 type employers who really had the scale, the bandwidth, and just a number of employees to be able to support that model. Today, it's open to individuals. We have practices, direct primary care practices that are freestanding, that are not focused on employers, that a family can join, an individual can join. Small businesses now can afford this model. At this point, it's still primarily, our primary customers are still larger organizations that are self-funded, but it's starting to shift and go down market to smaller employers and individuals.
Okay, Igor, thank you so much for your time today.
Thank you for having me.
And I've just been speaking with Igor Kozunov, who is the CEO and managing partner of Wellness for Life Medical. Stay tuned, we have many more interviews to come. We're just getting started. Thanks for watching.